Los Angeles. I'm also, for those of you from LA County, I'm co-chair of the USCC subgroup of the County Mental Health Department. I'm co-chair of the LBGTQ committee. And I say that because of our positives that, first of all, I also want to acknowledge the incredible brothers and sisters that were in that group that shared some of their life experiences that were very painful to hear. And also, they came up with solutions, So thank you, my brother and my sisters who were in that group. Part of the positives were, as an example here in Los Angeles, there are subgroups that meet on a constant basis, and they have a budget of $100,000 a year that they create their own programs, and they vote on them. So it's all peer generated. They vote on them, and then they show their results to the rest of the committee. So it's broken down through the various groups, subgroups, and includes faith, LGBTQ, Native American, Latino, African American, API. So that's one of the things that was working. The second thing that was identified that was working, that some counties, like in Los Angeles and San Diego County, that there's actual funding for LGBTQ programs. But be mindful that this doesn't happen across the state of California. There's a great need yet to have LGBT funded programs in the area of treatment and in prevention. The challenges is the collection of data, of SOCI data in cultural competent ways that include refugee communities and immigrant communities. In many situations, they could be life-threatening. I just want to share a brother who's here from Africa who was detained and imprisoned for being gay, who was beaten, and he comes to the States and finds no services for treatment and care. And this is a reality. The other challenges that we identified was the multiple levels of disparity among people of color. When we talk about disparities among people of color, we always just look at the color, but there's these subgroups, like in the Asian community. You know, we talk about the Cambodian, there's a Filipino, there's the Chinese, the Taiwanese. And so the same thing in the African community, the Asian community, and the Latino community. So we need to start addressing the disparities among racial, ethnic, but also all those subpopulations. And just lastly, just thank you for this opportunity. We know the government can be very difficult at times, and we see you as difficult, but you're also part of the solution. And the best way is really to come together as one group and work together. Thank you.